Hi everyone, this is Alex Zubarev for Casey Primary Study Group. The topic of our discussion today is pharmacokinetics. The term pharmacokinetics is derived from the ancient Greek words pharmakon meaning a drug and kinetikos meaning motion. Pharmacokinetics is a study of drug disposition in the body. Pharmacokinetics specifically focuses on the changes in drug plasma concentration. For any given drug and dose, the plasma concentration of the drug will rise and fall according to the rates of four processes: absorption, distribution, metabolism, and excretion. These processes are recognized by the acronym ADME. Let's discuss these processes further in details, and we'll start with absorption. Questions on absorption appeared several times in short answer questions and vivas in primary exam, most recently in the first sitting of 2020. Pass rate for these questions were pretty average, so there is a high chance that they will appear in the future.
Absorption is the movement of drug from the site of administration to the bloodstream. Drugs injected parenterally bypass biological epithelial barriers. In the gut, lungs, and skin, drugs must first be absorbed through a layer of epithelial cells that have tight junctions. For this reason, drugs face a greater barrier to absorption after oral administration than after parenteral injection. Bioavailability is the fraction of an administered dose of an unchanged drug that reaches the systemic circulation. Please note systemic circulation in the definition as opposed to just blood as drug absorbed. Drugs given intravenously have bioavailability 100%. However, this is not true for most drugs administered by other routes, as only a fraction of drug reaches systemic circulation. The area under the plasma concentration time curves, AUC, provides an integrated measure of drug exposure. Bioavailability can be determined by comparing the area under curve, AUC, for non-intravenous route with AUC for the same dose given intravenously. Drugs administered orally, intramuscularly, or subcutaneously must cross cell membranes to enter the systemic circulation. Cell membranes constitute a hydrophobic lipid barrier, and drug permeation can occur by direct diffusion through the lipids, diffusion through aqueous pores, carrier-mediated transport, pinocytosis. Pinocytosis and diffusion through aqueous pores have very limited significance in drug absorption. Active transport requires a special carrier molecule and energy. Active transport can transfer drugs against the concentration gradient. From the body perspective, most drugs have no nutritional value. So why bother? Only a few drugs are absorbed by active transport or by facilitated diffusion, usually when they're disguised as nutrients. For example, the antineoplastic drug 5-fluorouracil, which acts as fraudulent nucleotide. Most drugs are absorbed across the biologic barriers by passive diffusion. The rate of absorption is proportional to the drug concentration gradient across the barrier and the surface area available for absorption at that site, known as Fick's law. Fick's law states that the rate of diffusion of a substance across the membrane is proportional to the concentration gradient, surface area, and diffusion coefficient, and inversely proportional to the thickness of the membrane. Factors affecting bioavailability of drugs. Let's classify the answer and divide all the factors into two categories: factors related to the drug and method of administration, and factors related to the body. Route of administration. Like we already said, drugs given intravenously have 100% bioavailability, whereas drugs given by other routes should pass through a series of biological barriers, so that only a fraction may reach the systemic circulation. Presentation of the drug. Dosage forms affect the rate and extent of absorption. A drug can be given in the form of tablets or enteric-coated capsules. Using a complex drug may delay systemic absorption in subcutaneous injection, for example, insulin protamine. Physical forms. Drugs may exist as solids, liquids, or gases. Gases are rapidly absorbed in the liquids, while the liquids are rapidly absorbed in the solids. Particle size. Particle may be composed either of a single molecule or more than 100 molecules. The larger is the particle size, the slower will be the diffusion and absorption, and vice versa. Drug interaction and presence of other substances, including food. Foods or drugs may interact with the drugs to alter their rate of absorption. For the drugs given orally, food can increase or decrease the absorption. Similarly, drugs that alter acidity of the stomach or motility of the GI tract can alter systemic absorption and bioavailability of other drugs. Vasoconstrictors decrease the blood supply of an area, thus are useful to restrict the local anesthetic systemic absorption so that they remain for a longer duration. They wash away as well as their toxic effects are decreased in this way. Properties of the drug molecule. Lipid water solubility. Lipid-soluble drugs are absorbed by direct diffusion. Degree of ionization. Different drugs are either acidic or basic and are present in ionized or unionized form, which is determined by their pKa and the pH of the environment. Acidic drugs are ionized in the basic medium and basic drugs are ionized in the acidic medium. Acidic drugs are poorly absorbed from the basic compartment. This is called ion trapping. Molecular size. The smaller the molecular size of the drug, the more rapid is the absorption. Factors related to body that affect drug absorption. Area of absorptive surface, according to Fick's law. Area of absorptive surface affects oral as well as other routes. Most of the drugs are given orally because of the large area of absorptive surface, so that greater absorption occurs. Intestinal resection decreases the surface area, leading to a decreased absorption. Similarly, when the topically acting drugs are applied on a large surface area, they are better absorbed. Vascularity. More the vascularity, more is the rate and extent of absorption, and vice versa. In shock, blood supply to the GIT is decreased, so the oral route of drug administration is affected. The blood flow to the peripheries is decreased, so absorption in those areas is diminished as well. Therefore, intravenous route is preferred in case of shock. pH. Acidic pH favors acidic drug absorption while basic pH is better for basic drugs. GI mobility. GI mobility must be optimal for absorption of oral drugs. It should be neither increased nor decreased, which may affect the rate or extent of absorption. The first-pass effect is a phenomenon of drug metabolism whereby the concentration of a drug, specifically when administered orally, is greatly reduced before it reaches systemic circulation. Drug absorbed from the gastrointestinal tract travels immediately to the liver through the portal vein system. Hepatic first-pass effect occurs when drug is metabolized by enzymes within the liver to such an extent that a significant amount of the active agent does not exit the liver and, therefore, does not reach the systemic circulation. Let's check the college comments to the aforementioned questions on absorption. Define bioavailability. Outline the factors which affect it. This question appeared in the first sitting in 2017. 33% of candidates passed this question. The college comment. Many candidates did not specify that bioavailability describes the proportion or fraction of drug reaching the systemic circulation to differentiate from the portal circulation. Some candidates considered only factors impacting absorption from the GI tract or stated that bioavailability related only to orally administered drugs. Candidates failed to provide an equation or got equations or graphs wrong. Nearly all candidates failed to provide a comprehensive list of factors affecting bioavailability. Describe the factors affecting drug absorption from the gastrointestinal tract. This question appeared in the first sitting in 2014. 45% of candidates passed this question. The college comment. This is a very broad and open question. While a structured approach was useful, a sound knowledge of first principles or even being able to think on the fly would have provided candidates with enough opportunities to generate a pass. Define bioavailability, 10% of marks. Outline the factors which affected 90% of marks. This question was asked recently in the first sitting of 2020. 49% of candidates passed this question. The college comment: many candidates spent time defining and describing aspects of pharmacokinetics which were not relevant to the question. For example, clearance, volume of distribution, and half-life. Candidates who scored well utilized a structure which incorporated the headings of the factors which affect the bioavailability of medications with a simple description as to the nature of the effect. These factors included the physical properties of the drug, the preparation, patient factors, the route of administration, and metabolism, amongst others.